Am I the only one that didn't know how serious Lyme disease can be? Today we're going to discuss a very important topic, Lyme disease. This is something I get asked about a lot, and for good reason. It's a condition that can really impact your life if left untreated, but the good news is, early detection makes a world of difference. We'll be discussing 5 key signs of Lyme disease and what you should do immediately if you notice any of these symptoms. Let's get started. Let's talk about one of the most recognizable signs of Lyme disease, the bullseye rash. This rash often appears at the site of the tick bite and looks like a red ring surrounding a clear area. It typically shows up within a month and can vary in size. Not everyone with Lyme disease gets this rash. If you notice it, especially after being in wooded areas, see a doctor. Early diagnosis and treatment are key. Let's move on to another common sign of Lyme disease: fever and chills. Now, we've all experienced those pesky cold or flu symptoms, so it's easy to brush off fever and chills as just another bug going around. However, when these symptoms appear after a tick bite, it's important to pay extra attention. Lyme disease can mimic those familiar flu-like symptoms, and it's crucial to differentiate between the two. Think about it. You've been bitten by a tick, and a few days or even weeks later you start feeling feverish, chilled, and achy. Don't just reach for the over-the-counter cold medicine and assume it's nothing serious. It's always better to err on the side of caution and consult your doctor, especially if you live in an area where Lyme disease is prevalent. Remember, a simple blood test can help determine if Lyme disease is the underlying cause of those fever and chills. And the sooner you know, the sooner you can receive the appropriate treatment and get back to feeling your best. So, don't hesitate to reach out to your healthcare provider if you have any concerns. Let's talk about fatigue. We all experience tiredness from time to time, especially in our busy lives, right? But the fatigue associated with Lyme disease is different. It's not your typical "I need a nap" kind of tired. It's a persistent, overwhelming exhaustion that seeps into your bones and makes even the simplest tasks feel impossible. Imagine this. You wake up feeling like you haven't slept in days, even after a full night's rest. You drag yourself through the day, but no amount of coffee or energy drinks seem to make a dent in that deep-seated fatigue. That, my friends, is the kind of fatigue we're talking about when it comes to Lyme disease. It's relentless and can significantly impact your daily life. If you're experiencing this level of exhaustion, especially if it coincides with other symptoms like the bullseye rash or fever and chills, don't just dismiss it as stress or being overworked. Lyme disease can really take a toll on your energy levels, and early intervention is key to regaining your vitality.
Before we continue, please subscribe to our YouTube channel and hit the notification button so that you never miss a new video.
Now let's talk about joint pain. We've all experienced our fair share of aches and pains, whether it's from a tough workout or simply sleeping in an awkward position. However, joint pain associated with Lyme disease presents itself a bit differently. It often feels like a deep, wandering pain that migrates from one joint to another. One day it might be your knee that's throbbing, the next day it could be your elbow or wrist. This unpredictable nature of Lyme-related joint pain is what makes it so important to recognize. You might dismiss it as a minor sprain or strain, but if the pain persists, especially if it's accompanied by swelling, it's time to consider Lyme disease as a potential culprit. Another characteristic of Lyme-related joint pain is its tendency to come and go in waves. You might experience periods of intense pain, followed by periods of relative relief. Don't let those pain-free intervals fool you. Lyme disease can be sneaky, and those fluctuating symptoms don't necessarily mean it's gone away. So, if you're experiencing any unusual joint pain, especially after a tick bite, schedule an appointment with your doctor to get checked out. Let's talk about those pesky headaches and that nagging neck stiffness. Staring at a screen too long or sleeping awkwardly can trigger tension headaches or a stiff neck. Persistent headaches and neck stiffness, especially after a tick bite, could indicate Lyme disease. Lyme-related headaches are intense and can linger for days with little relief from pain relievers. If symptoms are severe or persistent, seek medical attention for early diagnosis and treatment. Thanks for watching. If you found this video helpful, please give it a thumbs up and share it with your friends and family. Knowledge is power, and spreading awareness about Lyme disease is crucial, especially as we head into the warmer months when ticks are most active. Remember, early detection is key when it comes to Lyme disease. If you're experiencing any of the symptoms we discussed, don't ignore them. Don't forget to subscribe to the channel for more health tips and information. Stay safe and take care.